Hi everyone, I'm Dr. Shiva Raya and I've got Dr. Sam Kapila, an ENT surgeon who works in the inner west of Sydney and also in the city, to talk to us today about tonsillitis. So hi Sam.
Hi.
Thanks for coming onto my video.
My pleasure.
Tonsillitis, very common. It affects children and adults, and so I thought I'd talk to Sam today about how to differentiate between viral tonsillitis and bacterial tonsillitis, which ones need antibiotics and who needs tonsillectomies. So my first question to you, Sam, is what are the tonsils and what do they do?
Well, tonsils are basically lymphoid tissue, which is a part of the immune system. But there's lots of immune tissue all the way through the body. So even when we take them out, it doesn't have any impact on your immune system. Right.
And so what would be the youngest age of a person that you have seen who has tonsillitis?
Well, tonsillitis affects people of all ages. I've seen it as low as infants in children's hospitals, but we often see it in kids, in teenagers, and into young adulthood.
Okay. So with tonsillitis, there's viral tonsillitis, there's bacterial tonsillitis, and it's sometimes a bit tricky to try and differentiate between the two. My understanding is that viral tonsillitis usually is accompanied with, a cough, a runny nose, usually doesn't have a fever as well, whereas bacterial tonsillitis has a fever, it's quick onset, very sore throat, sore glands. Does that sound about right to you?
Yeah, absolutely. And often with bacterial, we'll also see the pus discharge on the tonsils, which is the classic white discharge you see in the photos.
Right. And so we've traditionally been using antibiotics a lot to treat it, but now there's a push to use antibiotics less because it reduces the length of infection by maybe a day at best. What do you think about that?
Well, often when people are seeing me, they've already been through a lot of the more severe symptoms. But I would think about antibiotics in situations like decreased oral intake. So if people aren't able to eat and drink, then there's going to be a risk that there's dehydration or malnutrition. So those are the types of situations where I would consider that, as well as optimizing the pain relief so that we can actually get them to eat and drink as well.
Yes, and there are a few at-risk groups who need to be treated with antibiotics. So it's actually a good idea to have a conversation with your GP about it first, and then if it's recurrent episodes of tonsillitis, then
that's where we often come into the picture. So if you're getting infections all the time, that can have an impact on work, on school attendance. Sometimes you're the primary carer for somebody and you can't afford to be sick all the time. And so then sometimes we can help by taking them out. And we have guidelines for how often you have tonsillitis and it's actually affecting you, but the best way is to come in and ask your GP.
Okay, so just ballpark figure. At what number should a person be considering getting their tonsils taken out? Like how many episodes of tonsillitis?
Yeah, I generally use the broad rule of about 5 in a year, or if you've had less than that, then maybe 3 a year for 2 or 3 years in a row, or maybe even 1 to 3 episodes for 3 or more years in a row. So often we see people who've been having a few episodes a year since they were teenagers, and now it's impacting on their work, and that would be a reasonable explanation for why we might take them out.
Okay, and what's the process like? Is it a day surgery? What's the recovery like?
What's involved, in other words?
Yeah,
look, basically for children, I'll usually keep them in for 1 night. For most adults, I'll let them go home the same day. The biggest problem with having your tonsils out is that you do get a sore throat for about 1 week.
Right.
And so in that time, you've got to make sure you have your pain relief, eat and drink, keep up your hydration, and then once you pass that week, that'll be the last time you have the sore throat from the tonsils.
Right, and what's the complication rate like for bleeding?
So bleeding is the thing we worry about. We put that risk at around 4% across the board. And so the most important thing you can do is eat and drink, and it does happen from time to time.
Okay, so once you're past that initial stage, are there any long-term disadvantages to not having your tonsils?
Essentially not. As we mentioned, the immune tissue is all the way through the body. So the only thing that happens is you don't get sick all the time from your tonsils. So that's quite good.
Okay, anything else you think we should know?
Gosh, I think the most important thing is if you're not sure, go and see your GP. Sometimes people have had their tonsil infections for so many years and they don't realize there's a solution. So always a good thing to ask about in your next consult.
Great. Thanks so much, Sam.
My pleasure.